In this procedure, we use thermal radiofrequency energy to destroy the very tiny medial branch nerves that supply the cervical facet joints. The typical patient that undergoes cervical thermal radiofrequency neurotomy is a patient who's been involved in a motor vehicle accident. The other group of patients are patients who have degenerative cervical spine conditions, that is, wear and tear. If the patient has excellent response from diagnostic cervical medial branch blocks, then they can expect the same relief that may last 6 months to a year. The patient would be brought to the fluoroscopy suite, given sedation through the IV so that they're comfortable. The area overlying the cervical facet medial branch nerves would be numbed up using local anesthetic. The patient would have been positioned on their stomach in the prone position with the head turned slightly to the side. Once the patient's comfortable and the area is numb, and only then would we introduce this 16-gauge radiofrequency cannula towards the posterior aspect of the articular pillar where the cervical medial branch lies, and we would slowly advance this cannula or needle under direct fluoroscopic vision to lie in a position right parallel to the known course of the cervical medial branch, that is, the nerves that supply the facet joints. Once the cannula or the needles are in proper position, radiofrequency energy is transmitted through the cannula to destroy those small medial branches and attempt to provide relief that lasts some 6 months to a year. The procedure is generally well tolerated because we've not only given the patient intravenous conscious sedation so they're conversive with us but not fully aware of what's going on, but in addition we've numbed up the skin and underlying tissues with a local anesthetic or numbing solution. The typical recovery time of this procedure to see the full expected results of the procedure, that is, near complete reduction of the typical pattern that the patient originally presented with, are generally reduced some 80% at either 3 weeks or 6 to 8 weeks.